Good morning. I'm Tim Rushton, and I'd like to talk to you about rehabilitation programs for patients who've had heart attacks and undergone surgery. A patient may, for example, have had stents inserted to widen their arteries, and this solves an immediate problem without guaranteeing their long-term health. The importance of taking the drugs that have been prescribed is undeniable, and non-compliance is seldom an issue. But the patient's ability to improve their prognosis through the choices they make is sometimes not fully appreciated. If a patient takes exercise and makes dietary changes, they're more likely to lose weight, reduce their blood pressure, and possibly control their level of cholesterol. The evidence available suggests that once someone's going beyond moderate exertion and can sustain such effort for a longer period, then the vascular system and muscles adapt and strengthen. Basically, the cardiovascular system starts to perform more efficiently. We actually have some pathological reversal, and that's an extraordinarily positive message to give patients. What I find shocking is that annually thousands of people are choosing not to do potentially life-saving cardiac rehabilitation therapy. Joining a rehabilitation program after a heart attack can cut an individual's risk of dying in the next year by as much as a fifth, and will significantly reduce the probability of having to be readmitted to hospital with a recurrence of heart problems. Many people opting out of rehabilitation seem to be well informed about these facts and figures, and yet research shows that even if a GP refers them and makes the process of signing up easy, patients may decline an offer made to them or drop out of the program quite soon. It seems that many patients are convinced it's dangerous for them to do too much exercise in a rehabilitation program in case it puts them back in hospital with a second heart attack. I regret to say patients are picking up mixed messages from the media. The benefits of exercise are certainly discussed, but there are also warnings about embarking on exercise programs, especially for those who have done little previously. The reality is that the chances of having a cardiac event during exercises done as part of a rehabilitation program are extremely slim. This is mainly a direct result of the exercises having a clear structure, with a warm-up stage beforehand and a gradual step-by-step cooling down period at the end. What about other reasons for people not doing rehabilitation therapy? Let's consider the case of one. I'll call her Lucy. The idea of exercising in what she assumed would be a gym, or a setting closely resembling one, made her feel uneasy. Lucy felt that, like many people, she wasn't exactly sporty, and so would feel out of place there. She expected the group to be largely male, and with good reason. Significantly more men than women have heart attacks, but this imbalance didn't bother her much. She thought the instructors would probably be fairly strict, which she felt she could cope with. However, Lucy still didn't show up for the first session. But when she overcame her dislike of being in a gym, she found it more enjoyable than she imagined and stuck with it. Let's consider how rehabilitation programs could be better in the future. Firstly, most programs are based on group-based exercises, and this may not appeal to everyone. There's also evidence that individuals from areas of greater social deprivation are less likely to participate. It seems to me that health professionals can't always blame the patients for not taking up offers. Sometimes what's available has little appeal. Consideration should be given to running programs based more on what individuals can do in the privacy of their homes. Greater resources could also be put into setting up online programs. In general, more can be done in tailoring programs to suit a wider range of individuals. Finally, I'd like to tell you about one of my own patients. Let's call him Michael, who was diagnosed with coronary artery disease at the age of 52. After surgery, he totally lacked confidence. Every little ache and pain he experienced made him think that there was a new problem with his heart, and this held him back from resuming normal physical activity, let alone taking on a rehabilitation program. He was booked on a cardiac rehabilitation program involving 8 weeks of closely monitored exercise, but equally importantly, he had sessions with a clinical psychologist to help manage the anxiety he was feeling. Now, he claims to be in a better place emotionally than he was before his heart attack. Rehabilitation isn't just about building up physical strength and fitness. There are other dimensions.